Before interview season begins, remember your CV. Everything you have mentioned on your CV, you should remember your CV. Before every interview, if you get 10 interviews, before every interview, just quickly look at your CV. So you remember everything on your CV, because everything can be asked. Everything can be asked. Everything on your application. Look at your application. Everything can be asked. If you mention your local language, probably somebody from your own country will be sitting out there and throw some questions in your own language to check how you take surprises and how fluent are you in this second language. Second language is a good qualification, especially if you are fluent in Spanish in this country. I congratulate you. If you are fluent in Spanish in this country, I congratulate you, because your chances of residency are really, really high. If you are not fluent in Spanish, try to learn Spanish and be ready. They will ask questions in Spanish. It happened to me in an interview. I went to an interview. They said, "Oh, you speak Spanish?" I said, "Yes." And another interviewer sitting on the left side, the woman, she asked me a question in Spanish right away. I wasn't expecting it. And I turned around and I replied to her in Spanish. When I replied to her in Spanish, she was like, "Wow, he knows Spanish." So remember, if you are fluent in Spanish, congratulations, and be ready to answer questions in Spanish. If you are fluent in Hindi language, be ready to answer. If you're fluent in Punjabi language, that's a very useful language in hospital community, in areas where people from Punjab region of India and Pakistan live. It's considered very, very rich language. And another language, French, Arabic. If you live in Michigan, applying for Michigan residency, and you are fluent in Arabic, very good chance. If you live in Florida, Spanish. Texas, Spanish. California, Spanish. New Mexico, Spanish. Okay, so see which area you're going, and you can use that skill as your selling point. Read your CV. Anything on your CV will be discussed. So remember this. That's the pre-interview session that has finished. Now, during the interview, I'll quickly wrap up a few things, and we will do another session in more detail, and we'll discuss that. During the interview, I want you to remember your body language plays a huge role. If your shoulders are like this, you're like this, you lose. Your shoulders should be straight. Your back should be erect. You should be looking in camera, if it's on camera, or eye contact, as I said. Your hand movement, practice your hand movements without pointing finger. Without pointing your finger. Maximum, you should not show this part actually. Maximum, in a speed like this. Usually the palm like this. Try not to show this as much as possible. And one trick for interviews, don't sit like this. You lose interview automatically. If you sit like this, it's a defensive pose. If it's a defensive pose, it's a defensive posture. You fail interview right away. On camera, in real life, you gotta sit like this. This is the best position. Put your hands like this. You throw some kind of unique energy when you sit like this. See the distance between my arms here? The white color here? Why I'm showing you this? To let you know that this looks a nice gesture for men, even for women. Open-chested, straight, with a smiling face. When the Zoom call begins, you say, "Hi, sir. Hello. How are you? Wonderful. Nice to see you." The way you talk, your tonality counts, should not be monotonous. You should not be monotonous. People who are monotonous, they mess up. So these are some tips that you should remember for today's session. We will continue another session of residency interviews part 2, and we will discuss all these things that I have today. I don't want to make you bored. I think this is an hour-long and 20-minute session. That's enough. I don't want to keep it longer. You'll do another session. I think we should do it next week. And another session will go in more detail. And we will discuss all those things that are left. We already discussed the greeting. You say hello, you see greet. No, we did not. But thanks and please, eye contact. Most of the things are already discussed, but we will do another session in probably next week or in a couple of weeks. We'll do that another session. So you remember these things, watch this lecture again, rewind it, fast forward it, take notes, nothing should be missed, and practice doing those things. Your confidence should be shown from your body language, because sales is a transfer of energy and enthusiasm.